Hello, everyone, and welcome to the SavvyCast. I am so grateful that you're tuning in, whether you're listening to the podcast or watching on YouTube. I think this is going to be a great episode. Many of you listening or watching walked through my journey with Cam, from detecting that there was an illness to having to let him go. And today I have a very special guest. I have Dr. David Sender. He walked alongside us through this journey with Cam. He is at the Auburn Vet School and Hospital. David Sender, welcome to the SavvyCast. I'm so grateful that you're here.
Well, thank you for having me. I appreciate it. It was definitely a journey we went through with Cam. He was super duper sweet, and I know he wasn't particularly old. He was definitely one that was lost too soon, I think. But the important stuff for me is not just being able to take him through it, but being able to take you guys through it as well. And I know it was a really, really difficult situation for honestly everybody involved. As much as I can, I try to keep a step back from that to some degree, but it was I'll just say it was very difficult, I think, for everybody involved in that situation. And that was working with us also had a real hard time with it too.
Yeah. And that's where I do want to address that aspect of how you and Brian, who is also alongside us, handled the difficult part, which was emotional and personal. But to kick off on a lighter note, as an icebreaker, I always ask my guests, what would you choose as your last meal? So let's start on that note.
My last meal, I actually probably should have thought about this a little bit more. When I was younger, my mother used to occasionally make these skirt steaks, basically, or flank steak kind of thing.
Yeah.
With some sauteed mushrooms. They're quite delicious.
Well, Dr. Cinder, before we dive into, I have a lot of questions about dogs, and for my followers who have other animals, I apologize. This will be dog centric, but can you just give us a little insight into came to the Auburn School and chose veterinary medicine?
So I'm originally from Chicago area, the northwest suburbs of Chicago, and I loved being active and I loved being outside. And I was the kind of kid that, like, in the summertime when the caterpillars would come out, I would go and catch a bunch of caterpillars and try to raise them into moths.
Wow.
And other really, really weird things like that. Like, I just loved being kind of, again, outside in nature, working with animal kind of things. And then it definitely grew from there. And as I started getting a little bit older, like, more towards junior high kind of age, I really started to appreciate all of the biology and the science and stuff behind all that stuff. And those became more of my favorite subjects. So when I was in high school, I actually debated a little bit between human medicine and animal medicine, or veterinary stuff. I actually grew up with a good amount of medicine throughout most of my life. My father actually does emergency medicine on the human side of things. He actually just recently retired, but he had done that throughout my entire life, basically. So we grew up with, I'll say, some very not typical dinner stories from him.
Oh, yeah.
There's a lot of things that you hear about in human emergency medicine that is very interesting. So I grew up with a lot of the medicine stuff. And then again, in high school, as I was really kind of starting to take shape in some of this stuff, I debated between kind of human and veterinary medicine for a little while. And I think what it came down to for me when I was in college and starting to get some jobs working at different veterinary practices and that kind of thing, what I really appreciated was not just being able to work with animals, but also being able to work with the people that own those animals. And I think what veterinary medicine gave to me basically was not just the normal challenges of medicine in general, but in veterinary stuff, there's the added challenge of our patients can't speak to us in the way that we're used to listening, right? They have kind of their own language. And those are things, honestly, that I really enjoy sort of learning from them and learning to read from them. So I don't want to sound too crazy in this. I think they do talk to us, but they talk to us in a very different language, in a very different way. And it's just a matter of being able to read that. So I think for me, the extra challenge of having to work through that a little bit, as well as the extra bonus of when I can make an animal feel better, it's not just that animal that I'm helping, it's also their whole family that I'm helping too, because of the bonds that we have with them. So I really do enjoy that kind of stuff. Now, I think what I'm doing at Auburn is a residency in emergency and critical care. And so I won't go too much into it, but I had a little bit of a veterinary career before coming here. And I decided to come back to do this specialization, basically. So emergency and critical care, as you've kind of gone through, unfortunately, is really the sick of the sick, right? So we deal with the ones that really are not doing well, or like the trauma cases, the really, really critically ill ones, those kind of things. That's sort of what I don't know that I can necessarily say that I enjoy that, because it's not pleasant to deal with the animals when they're that way. But what I do enjoy is being able to improve the situation from where they're at. And I think that particular field, that specialty, has more challenges in it than even just your regular everyday veterinary kind of stuff. So as I'm sure you're getting, I tend to be somebody that I like to be challenged. I like to deal with difficult situations. And my goal in any of those is to try to improve them from where they're at. I may not be able to fix everything, but at least kind of working everybody through that and getting it to a better point is kind of what I aim to do, I think, with most of my cases.
Since you do see the worst of the worst, do you typically see dogs come in that you know are not going to fare well? And do you try to hold that back until it's pretty clear to the person and they arrive at the conclusion? Or that is a difficult thing to have to do?
I think a reasonable way to think about it from the kinds of cases that I tend to see is really in trying to not make too many judgments too quickly. Because I think we all have a tendency to, let's just take a relatively straightforward like trauma case or something like that. Something that unfortunately we see quite a bit is dogs that get hit by a car, right? So they get out of the, wherever they're supposed to be, and somebody didn't see them, whether it's on purpose, accident, whatever, they get hit by some sort of much larger thing than they are. It's really, really easy to get stuck in a mindset when that animal first comes in. It looks bad, right? Like they have all these wounds over them, they have all this trauma, they are in shock, all those kind of things. And it's a shocking and stressful and terrible experience for everybody involved initially. And I think one of the more challenging parts of the emergency and critical care is taking a half a step back from there and saying, okay, let's evaluate what we have now. Let's see what we can do and how much we can make them better before we make any sort of like more significant decisions. And I think the hardest part really is taking it that one step at a time to some degree, because we all want an instant fix and we all want to know the answer like right now, right? And a lot of times we need to try as much as we can to have the patience to put some of that instantaneous stuff on hold just to see what we're actually dealing with. Because honestly, I do really enjoy a lot of trauma cases. And in particular, I like head trauma cases as well, because oftentimes, I know that sounds bad, but oftentimes they do really come in looking pretty terrible. And if we treat them appropriately and give them time and support and all that kind of stuff, oftentimes, honestly, they do really well. And seeing that transition from they come in looking really, really bad to they walk out of the hospital 3, 4, 5 days later, while, that 3, 4, 5 days seems like forever, it is also, significantly improved from when they came in, right? When we were wondering, are they even going to make it? Should we even keep going? And now they're walking out of the hospital a few days later. So those are the rewarding cases. I think what you were getting at is some of the more difficult ones can certainly be when there's not a lot of chance or we don't know what the chances are. I think though I think that second one that I just said, I think the ones where we don't know what the chances are, I think those are probably the most difficult. The ones even when we know that there's not a lot of chance of success, at least we kind of know what we're dealing with to some degree, and we can tailor accordingly to some, I guess, to manage expectations a little bit.
Mm-hmm.
But the ones that we really don't know, I think those are the most challenging cases for me, honestly, because that means I can't come up with a great direction, a great plan, recommendations, guidance, all that kind of stuff for the people that I'm working with. And that's the part that gets to me the most.
Mm-hmm. Because I know in our situation, you're being begged to give an answer and you can't give it. And then, you have a dog that you don't want to send back into, a cone. And, I did not mean to get emotional, but let me, yeah, I was afraid this would
There's
happen.
a lot. I was afraid we'd get some of that stuff. And I know a lot of this is going to hit home for you. Unfortunately, I will try as much as I can to be very delicate with that stuff, but
well, it happens to a lot of people. And this is going to be very helpful to a lot of people.
Good. I hope
and
so.
I appreciate this. But based on what you have said, that leads me to the next question. Can someone just go straight to the Auburn Clinic without a referral?
So I guess the best way I can answer with that is we have obviously an emergency and critical care service that's open 24/7. Actually, I'll come back to that in just a second.
Okay.
But in that sense, if there's ever a critical animal or an emergent animal, those are always welcome to show up as, walk-ins or whatever. We usually ask to try to call ahead if you can, just so that we can, to some degree, expect you. When it comes to other specialties or other referral kind of things, those generally are made on an appointment basis. So, if you wanted to see, like I actually saw you on the internal medicine service. So that was when I was doing a rotation through them. It's a good thing that I got Cam, because I tend to deal with cases more like Cam than they do. For something like internal medicine, those are generally still not set up on an emergent basis. We do have kind of a way to deal with those if necessary, but most of the cases that go through something like internal medicine or need specialty surgery, we have almost every specialty. I think the only thing that we're missing right now is cardiology for the most part, but we have oncology, there's dermatology, there's ophthalmology. So like if they need specialty work in any of those areas, it's usually still made on an appointment kind of basis. So whether that's through your regular vet is usually the best way to go about it, and they kind of help you set up a referral. And then they can also then send us their records so that we can kind of all get on the same page of what's going on with that particular animal, versus you just call on your own and make an appointment. Both are reasonable things. Generally speaking, we want you guys to be working with your regular vet. So as much of a team kind of approach we can make is better. But like I said, if there were ever an emergent kind of thing, there's still, at any point, you could still always show up to our emergency critical care service and be seen right away. But most of the other specialty stuff is seen on an appointment basis.
Okay. And I know you were with Cam pretty much the entire time. Do y'all try to stay with the same patient during the duration, where one person is communicating with the owners and
as much as we can, we try to. I think one of the big things to understand about a teaching hospital like Auburn is that it's exactly that. It's a teaching hospital. And so with that, we do have rotating interns that are doctors as well. They usually have just recently graduated veterinary school or graduated the year before. And now they're rotating through all the different services. So we have interns that are part of our team. We also have residents. That's what I'm doing and the residents basically are training for a specialty. They are working to become specialized in one of those particular fields that we were talking about. And then we also have overseeing faculty who are already boarded or have completed a residency. And so all of these people, as well as all of the students that rotate through the different rotations, are usually involved. But one of the big things to understand is that I'm just saying the collective, we still kind of rotate through a little bit. And so I think more than most people would like, there's not as much of that continuity as you might have in some of the more private practice sort of situations, because we do have, on any given rotation, usually our rotations last about 2 weeks or so. Mm-hmm. But if you come in towards the end of a rotation and you start with, let's say you start with an intern. Well, actually, I can even give you a worse example. So you come in through emergency, right? Then you're going to see whoever the emergency doc is that's on at that shift. And then come morning, if that animal is hospitalized, you'll be transferred over to another service, or at least another doctor in the same service. And if you come in towards the end of that rotation, mm-hmm. then if that animal is there for a handful of days, you might actually still switch over again to somebody coming on that rotation. So there is a lot of that sort of turnover.
Right.
The good thing is, because we have all those different levels of people kind of working with all of these animals, one, that's lots of eyes and hands and whatever that are on those patients. So we can be, if nothing else, we can be thorough.
Yeah.
But then two is that there's usually some sort of consistency still between those cases, even if it's just the overseeing faculty who is on that rotation, most of the time, basically. Even if you have a different doc that you're personally speaking with, there's usually still somebody behind the scenes that has seen that case through pretty much the entire way. But I will say, what I think the general public and your listeners should know is that there is going to be a lot more of that doctor turnover. And you might talk to 3-4 different doctors, depending on how long you're there.
Yeah.
So there is more of that, but we try as much as we can to keep some degree of continuity as well.
Let me ask you this. When you have a dog that is not going to fare well, at what point do you ever bring up the subject of euthanasia?
Yeah, that's a really, really tough question. I can tell you my answer. I can also tell you my answer is going to be different from everybody else's answer.
Right.
And every answer is going to be unique. My personality style, I prefer to be as open as possible, and sometimes too much so, even that I have to kind of like pull back a little bit. But I very much believe in the workplace of being open and straightforward, and as real as we can be. And so what I try to do is present all of the options, and then we kind of discuss from there, right? So I can give you options A, B, C, D, E, but if there's only A and C are reasonable for your situation, then we focus on those. I still feel like it's my job, or our job, to kind of give the clients all of the options that are available. And I think one of the pitfalls, honestly, that we get into is, we as in veterinary stuff in general, is in making too many assumptions. I think we're all, to some degree, we as in people are all guilty of making assumptions, and those assumptions may or may not be correct. So the way that I try to approach it is give each client all of the options that are available, and then try to hone in a little bit more on the ones that might be more specific or might be more appropriate for that specific situation. So if we get an animal, I didn't really want to give this example, I'm going to try to do it as best as I can. Let's say we get an animal that comes in with a very, very complicated disease process that we know, like, even if we get the answer, we get the diagnosis, and we can do all of the treatments, we know that it's going to be very involved, both in time and resources and money. And if there's a situation where that client is expressing to me that honestly they just can't, for whatever reason, whether it's emotionally or time wise or money wise, can't afford to do all of those treatments, the way that I look at it is, how can we make the situation, how can we make the animal better? And if there's no way to realistically make that animal feel better, that to me is what is sort of my trigger for when we might discuss a euthanasia kind of option. And I really, really hate the cliche of using euthanasia to like relieve suffering. But really, if you want to break it down to its roots, basically, I mean, that's what it's there for, right? So if we can't make that animal better for whatever reason, whether it's we don't have the abilities or whatever, if we can't make them better, at least we don't have to have them suffer. So to me, like I said, that's sort of my trigger is when we get to a certain point that we just aren't going to realistically be able to make that animal feel better, then we should consider not asking them to suffer anymore. Does that make sense? I hope.
Yes, it does.
And that kind of hits home to you a lot as well. And I apologize.
Yes. And I will say that probably the hardest thing is second guessing yourself, knowing that you made the decision with family and friends. That's the hardest part, because I think any pet owner who loves their pet like family would make that decision if they knew their pet wasn't going to get better. I think the difficulty is thinking, well, should we or could we have kept going? Do you always, knowing that people are going to be in a very emotional, distraught state of mind, do you always try to be very clear if they should keep going? If they bring up euthanasia too early, in your opinion, and you're like, ooh, we don't need to go there yet, do you say, wait, we don't need to go there yet, it's not time?
So again, I think that's a very, very reasonable and a very difficult question. I can answer that for me pretty easily. And I will tell you again, if you talk to, 5 veterinarians, you'll probably get 7 answers.
Right.
For me, again, my communication style is just very direct. I don't like to beat around the bush, and I don't feel like that really helps anybody. And so I personally don't generally feel uncomfortable in sharing my thoughts as to when or if euthanasia is appropriate. I can 100% tell you, though, that it's not necessarily typical or common necessarily, even that other veterinarians will very much, I think we sort of have a spectrum to some degree, that some veterinarians feel like it's never their responsibility or even their right to bring up euthanasia. And others will say that it absolutely is. And I think we have everything in between there as well. And I think one of the biggest challenges of veterinary medicine is walking this very, very fine line of directing and guiding our clients versus deciding things for them. And I think one of the biggest things, if I could tell everybody in the world this, I think one of the biggest things really is for clients to have an understanding that we are people as well. And as much as we can, we are trying to walk you through and guide you through whatever experience it is that you're going through with your pet and with the patient. At the same time, we're going through that with you as well. And we can bring in as much of our medical and other kind of experience with it as much as possible to try to make appropriate decisions or direction or guidance or all that kind of stuff. But we are people going through not the same, but going through the experience with you at the same time. Again, going back to that team-like approach as partners, we are making the decision together. I think that helps in a lot of ways. One, it builds a lot of trust. And then 2, it doesn't put too much control in any one person's hands. And to some degree kind of leaves everybody walking away, regardless of how the situation goes. It leaves everybody walking away feeling like they had a say in the matter. And I think that's one of the most important things, is to not feel like, for anybody involved, that the situation is not in your control or that you didn't have a say in how things went. The veterinarians, regardless of how, I don't care how experienced they are, how long they've been in practice, there are mistakes to be made in that for sure. And again, we are people, and we try as much as we can to keep our personal feelings out of it. I think some veterinarians do a better job than others, but it's still a process that we are learning from constantly all of the time, as much as you guys are. And it sucks. And I wish we had, more perfect or planned or predictable ways of going through that stuff. Again, at least the way that I see things is every situation is a unique one. And yes, there are relationships and similarities between them that you can, pull from other things that you've dealt with in a similar situation. But each scenario is still going to be very unique in and of itself, right? And so you can't necessarily handle it the way that you handled these 10 other ones that you've done before. You still have to try to, as much as you can, this is again my opinion on it, approach it as the unique individual experience that it is. Because for everybody that's going through it right then, it is exactly that. It doesn't matter if you've seen 50 cases before of this particular disease. Those 50 have nothing to do aside from bringing some clinical experience for you for that individual right then scenario. And so as much as possible, trying to look at each one as that, I think is the best way to go about it. And that team approach, like I said, to try to have everybody have a say so that not one person is making the decision, not one person is at fault or whatever. And then I honestly, the biggest thing, if all of that stuff wasn't enough, at the end of the day, we still just have to be able to live with the decisions that we made. Both you guys as the clients, us as the doctors, the animals to some degree, even though they don't really get a lot of the decision. Everybody still has to be able to live with the decision that was made. And if I can give any piece of advice on that, it's that in those situations, as long as you as in the team have evaluated all of the information that you have right then and discussed reasonably the options and ways to potentially go forward. If all of that conversation and evaluation has happened, then I think whatever decision is made, it's not necessarily even just a good decision, but it's the right decision. And I think hindsight obviously is 2020. If we had all the information in the world, we can always go back and say, well, if we did this, then maybe this could have happened. But the reality is in the moment, we don't have that. Right? We don't have that hindsight. We only have the information that's available to us right then. So as long as you've evaluated the information that you have then and the discussion of the options, if those things have happened, then I think whatever decision that you make is not only a good decision, but it's the right decision as well. And that's what we should walk away with.
Mm-hmm. And then just know that even though you make the decision that you and your physician think is best, I believe everyone needs to realize that you will still question and it will never be easy.
It is absolutely not. You are correct. It is definitely never an easy decision, especially an end of life kind of decision is certainly, that's something that we can't take back. And so it's not an easy decision. I don't think it should be. If it was, then you probably didn't really have a great relationship, right? Yeah. Those are the ones that I really worry about. I think it should be a difficult decision. I think it should be a challenging one. And I think it should be one that, this sounds awful, but it should be one that leaves you feeling some degree of question because we are that devoted and dedicated to our animals. And at the same time, I think we also need to be able to walk away with that decision, knowing that we made the right one at that time, something that we can even look back on and say, it's okay. Even, going in the future, like we made that decision based on what we knew then.
Yeah.
So that decision was an okay and a good decision to make. And it is always, always something that we can recover with. And I say with because it's not usually something that we recover from. It's not like we ever move on from it. It's that we recover with it. And we keep it in our minds really almost indefinitely, probably.
I think this is something that it lends itself to deep discussion, but I have wondered how difficult that must be for y'all. I mean, I literally don't know how you do it.
So on the emergency and critical care side of things, I will say in that specialty, we tend to see that stuff more than most other specialties. I mean, I think if you were to talk to somebody from emergency and critical care versus somebody in dermatology, it's
right.
uncommon that a dermatologist is going to have to euthanize an animal. So the perspective is a little bit different, I think, from the emergency and critical care side of things, because we see the traumatic things and the sick ones. Like we tend to see it more commonly than others. In general practice, I would say it's a reasonably common thing, even if it's just because you have a phenomenal veterinarian and that animal has done well and is just continuing to get older and older and suffering from all sorts of little things, that their quality of life is just not great anymore. From the emergency critical care side of things, I can say that's something that we have to go through far more often than we would like. It is also still, as much as I can, I try to keep the perspective of it's still a way that I can make the situation better than it was when I first saw it, or when the animal came in or whatever. That if there really is a significant amount of suffering that we're just not going to be able to alleviate, we have euthanasia as an option. I don't think the number really matters. And I will say, the number is going to vary depending, there's some weeks that we have, or some days or shifts even, that just seem to be terrible. And then there's others where we don't see it quite as much. And then that's sort of the nature of emergency stuff, is it's sort of an ebb and flow kind of thing. But overall, I will say my department, the emergency critical care department, probably sees that more than most. We all have our different ways of dealing with grief and varying levels of internalization that we make. I think what I can say from my side of things is there are certainly some cases that take a really big toll on me sometimes, and that can be difficult to move on with. And there's others that affect me a little bit less than that. I think at the end of the day, we still cannot become complacent in it. And I think we still need to understand, we as in the veterinary community, or people as a whole, need to understand the finality of euthanasia, and it's not something that should ever be taken lightly at all.
Right. Is there anything that you would say to anyone who might face that, to assure them that there is no pain, and that, because I did not stay. I had to walk away. But my family, they all stayed. And is there any across the board advice that you would give to people?
Yeah. In terms of the specifics, what I would probably tell people is 99% of the time it does go very smoothly. There is a very small, the occasional times that it doesn't. And as much as we can, we try to manage those, and again, tailor it to the individual patient so that it works best, and for the clients as well. The entire experience, the way that it's generally done, and at the veterinary school, we have a fairly standardized way that we do it, but each institution, I think, is going to be a bit different. But in general, we'll give them a little bit of a sedative, or a combination of a sedative and or a pain medication at the same time. And there's different kinds that can be used, but usually there's some degree of a sedative, so that the entire experience for everybody, but in particular the patient going through it, is not so stressful, that they can just kind of get sleepy first. And then we'll give them the medication that what we use in most of the time in veterinary medicine is a drug called pentobarbital, which is kind of an older anesthetic drug. And we use it in different formulations. There are different formulations of it, but we basically just kind of use it at a very high dose, so that it has the same anesthetic effects, just more so. And this is the risk of any anesthesia, that, these things could happen. But this particular drug, pentobarbital, doesn't have quite as wide of a margin of safety as others. And so we really just kind of use that in an overdose. So what it does is just kind of, I say slowly because it's slow for the body, but when we're watching it outwardly, it's actually a pretty quick process, that we usually give them a sedative first, so they're sleepy or completely asleep sometimes. And then we give them that last drug, the pentobarbital, that just really works as any other anesthetic, and it slowly kind of stops their breathing and stops their heart. And then we'll listen to them afterwards always and confirm. But I think the biggest thing to know is that really none of none of the medications that we use at the hospital, at least, are ones that burn or sting or anything like that. And truly, to the animal, as far as I can tell, it just feels to them like they get really sleepy really quickly, and then that's really all they know. And so if everything else that they were dealing with outside of that is far worse than just, kind of going to sleep really quickly, then to me that's not a it's not a bad way to go. And I think that's something that everybody should understand, is that it does tend to be a pretty painless but very quick from the outside sort of process to go through. If I had some words of advice for somebody like your friend kind of going through it with an older animal, I'll just share. I've been in touch with my old coach from college. I did some athletic stuff there, and he and I still keep in touch a good amount. But he has had a dog that he had actually gotten before I had left California there, and he just recently put him down. So that dog was 14 years old, I think, and is a lab. That's pretty good. And he and I have been talking probably for the last couple of months of how do you know when is the time? And I think in every situation that's hard, but it might even be hardest when truly what we were discussing really is honestly, how do you know when? Because really all he was dealing with and all this dog was dealing with are things that we all deal with as we get older.
Yeah.
He was getting slower. It was getting harder for him to move around. He had arthritis, losing his hearing, losing his vision, all those kind of things, right? And these are things that we unfortunately see all the time. This is sort of one of the pitfalls of adopting something into your family that has a shorter lifespan than you do. That we unfortunately have to watch them go through these things most of the time.
Yeah.
The best piece of advice that I can make in that situation is, if you evaluate the situation with the information that you have then and you make your decision accordingly, then I think whenever you decide the time is the time, then that is the right time to do it. But whether we make the decision today, tomorrow, 3 weeks from now, 2 weeks ago, whatever, it's different for us because we want as much time as we can have with our pet, but it's really no different for them at all. They don't know the difference. They don't really have that concept of time. And so whenever it is that you decide is a perfectly appropriate time to decide. There is no right and wrong to decide when you're just dealing with old age.
Mm-hmm.
And I think one of the biggest difficulties that we as people kind of struggle with is we're hoping and looking and waiting for our pet to tell us when. And most of the time, they're not going to do that. Like, there are occasional times when we get lucky and they can kind of tell us, but most of the time they're not going to. And that's a decision that, fortunately or unfortunately, it's something that we kind of make for them. But I think if you're just waiting for your pet to tell you when, you're probably waiting too long.
Wow. Yeah. It's something. And I will say that I don't know if all of the doctors at Auburn do this, and someone may have sent it for you, but we sent a paw.
Yeah, that's something that we try to do for everybody. There are some people that don't want that. Basically, just to explain to everybody what we did, or what we generally do is we call it a clay paw or a clay paw print. But we have some clay that we can kind of make into a disc or different shapes or whatever, and then we'll make an impression of their paw in that clay. Some people will also do some ink prints, whether that's of the nose sometimes is what I know one of our interns likes to do, or of the paw. I personally think they are nice little subtle mementos to have. I know I have luckily so far not had to get one for one of my own animals.
Yeah.
But what I'm told from clients is some of them really like the texture of the clay because you can actually kind of like almost feel what the underside of the paw felt like on their little paw pads and things like that. I think they're, again, nice little subtle reminders of our pet. That's not too kind of in your face or anything like that. So that is something that we try to do for most of the clients. Like I said, I know there are some people that don't want those. So sometimes we'll ask you specifically if that's something that you do or don't want. Sometimes I try to just read the situation and decide if that client, you guys in particular, would appreciate something like that. So, and well, I guess the way that I kind of look at it is, for pretty much everybody involved in that situation, it tends to be kind of a nice little marking of closure. We can all kind of have that little memory, basically.
Well, it's interesting that you say that you have different clients. My daughter, who is at Auburn, was, she's not right now, she's at camp, but she received the package. And I said, you need to put it away. I'll look at it one day. And then she also went back and got the ashes. And I haven't looked at those yet, but I know at some point I will. So to anyone listening or viewing, you may not want to or be ready to initially, but at some point you'll be glad you have it. That's my thought. But anyway, well, okay, this discussion, I think it was extremely, extremely helpful for a decision that many will have to make that is very, very difficult. And I want to thank you for going there with me. But now I have lots of questions about dogs.
All right, let's do it.